Good afternoon or good morning. This is Lori Ferguson with Point of Care Department and Laboratory Services. Today we're going to learn about the Clinitek Urine Chemistry Analyzer for pregnancy and urine test strips. So this Clinitek Urine Analyzer, in addition to the actual analyzer, is going to have a platform underneath where it's network connected and also for the testing platforms, it's the 10SG multi-sticks. Each pad here gives a result, which is usually the top portion of a urinalysis, such as ketones, blood, protein, etc. The HCG test is going to be your pregnancy test. There's 25 in each box, and they're usually foil packaged individually. For the quality control, both of them use the dropper 1 and 2. The Clinitek uses it at a 30-day period and every day for the Clinitek SG. So if the instrument does go past its time, it will lock you out for patient testing until that QC is performed. Usually the level 1, or always the level 1 is a negative and the level 2 is a positive for both of these. So it would be positive for leukocytes, ketones, etc., and then it would give a positive pregnancy test on the number 2. Okay, so how do we perform? If you're at the instrument, you'll see this buttons. If QC is due, it's going to have this additional QC test pop up and say that you have to run it before you do any patient testing. So you can choose QC test. Most of the time it's going to also ask you at this point for your operator identification. You can scan your badge or type it in manually. You're going to want to make sure and choose the test that you actually want to run. So if you're doing the HCG, you're going to choose cassette test. And it's going to ask you to enter the lot number of your quality control, in which it is barcoded, and you'll have to put in the expiration date of the control. And then it's going to ask you for your same thing, lot and expiration of your cuvette, cassette, which is on the foil pouch when you opened it. You're going to go through all the steps here that it pretty much tells you to do. You do have to make sure and run this in order. So if it says negative on the first page, which it should, you want to make sure and pick up that number 1, put 3 drops in the sample well, and then hit start immediately. Once that is done and it has said passed, you can go on to the next control, which it will ask you for the positive. Again, 3 drops in that, and it will show up a positive on your cassette test. You go through the same steps. I'm just showing here that a lot of people get a little messed up, but if you go down and put 1 drop on each pad, blot the side, then put it onto your instrument correctly and straight, you will get your results without any errors. Enter your information and then enter your patient information. With your scanner gun, you can do both of those. You want to make sure, take the top off, dip the strip all the way to the very top pad, blot the side, put it in the little channel evenly, and make sure you hit start right away. It takes 2 minutes for the strips, and those again will be networked and go directly into the patient chart. For patient testing on the HCG, again, you will have collected your urine and labeled it at the bedside with name and date of birth of the patient and using the registration barcode sticker. The only difference with this is because you have a sample, you're going to need to use the pipette that's in the foil pouch along with the cassette. The barrel you'll squeeze, put it into the liquid, and then release. So you'll see the barrel get full of urine and then any extra with waste over here, and then all of it gets squeezed into the sample well. Then you immediately want to hit start before you walk away. So just to show you, even though the instrument does read a positive, negative, or other test results that are possible, we'll talk about later, you can easily see it whenever it comes out. If it's positive, it will have a line at the control area and a line at the test area. If it's negative, it will have a line at the control area and no line at the test area. And if it has no line at the control area and anything at the test area, it would be invalid. A few things to remember that are very important is you want to press start directly after loading the HCG cassette. Timing is everything, and those cassettes will turn positive if they sit around long enough. So to avoid a false positive, make sure that you obtain the sample in the pipette, put the sample into the cassette, and hit start right away. It's possible to get a third result besides positive and negative, but borderline if it's anywhere near that cutoff, because some tumors give off HCG, some autoimmune diseases can give off proteins that mimic HCG. If it picks up anything that's around the cutoff of about 25 microliters, it's just going to call it a borderline. What you'll see on your unit is nothing comes across on the patient's chart in Epic. You'll go back to the instrument, look up results, and it'll say borderline. That does not mean it's a negative. It means you need to investigate further. Many times you can just rerun it and you'll get a negative, especially if it's on an ER patient that, is older. But, use your best judgment. And if it's anything that's questionable, send it to the main laboratory for a quant. And we don't want to send anybody to surgery who's pregnant or hasn't gotten a good result. And again, one last reminder, the PC must perform in order for it to pass. So pay attention to that. There is an additional QR code in the ED to help you pass the second level. And again, if you're doing the Clinitek, you should have also already done the AccuCheck, but there are two options for your exam. You can click on this main campus point of care exam link or scan the QR code. The third option would be to the Ventranet departments and divisions, point of care, and then you'll see the same main campus point of care exams. Click on the link and it will take you to your online exams. All right, thanks.